WHO says that 4.5 million cardiovascular deaths in India. 1 in 3 people who die in India is because of a cardiovascular death. That's how bad the data is. Now, with the data in mind, I recently read a 19-year-old boy playing cricket, hit a six. This video went very viral. Hit a six, fell down and died.
Okay.
19 years old.
See, here, so this is where age plays a role. People think when somebody dies of sudden death, that is always heart attack. Okay. Other than heart attack, there are many other reasons for cardiac arrest. Okay. Especially in younger individuals, we should think of a lot of other things. There is a condition called arrhythmogenic right ventricular dysplasia. There is a condition called hypertrophic cardiomyopathy. And there are lot of long QT syndromes, short QT syndromes, which all can cause ventricular arrhythmias and that can land up in cardiac arrest. Let me simplify it for you. When somebody has an heart attack, why does that person die? When somebody has an heart attack, when we say it is cardiac arrest, it is predominantly that heart is not pumping is one thing. The other thing, why that heart is not pumping means either the heart pumps at a very faster rate. It goes more than 200 and it is not able to send blood to any other organs, including its own muscles. So, the patient is going for a cardiac arrest. Okay. So, similarly, when an electrical misfire happens, the heartbeats can go more than 250 and people can develop a cardiac arrest and die. So, there can be a lot of other reasons than heart attack itself for cardiac arrest to happen. And people whom we should screen this is one, when there is a strong family history of sudden cardiac deaths. In those families, there are certain conditions that needs to be screened and they should be evaluated. Whenever there is a sudden cardiac death, an unexplained death that happens at home, definitely a postmortem needs to be done and it needs to be found out what is the cause of death, and if it is a thing that can run in families, that should be identified and that should be prevented.
So what you're saying, doctor, ideally is, because normally in our culture, if somebody dies of a heart attack, we say heart attack and we cremate or bury because it's a heart attack, because we have made it very normal that heart attack happens. What you're ideally saying is, if a heart attack happens, we need to understand why the heart attack has happened.
See, why that cardiac arrest has happened. Yeah. So the terminology.
What's the difference? Yeah, first tell me that. What is a heart attack? What is a cardiac?
Okay. So an heart attack is, our heart is a muscle. That muscle needs blood. Okay. That blood is only going to give the essential oxygen and nutrients for it to pump. So our heart, basically all of us will have in normal 3 vessels. Some people will have 4 vessels that supply the heart. Okay. Heart has 4 chambers. The left ventricle is the last chamber from which the blood is pumped through the entire body. It has a valve called aortic valve. Right out of it is the coronary vessels. That is the vessel that supplies the own heart itself. If there is a problem in that valve, the very own heart itself won't get enough blood. Okay. So now we have established the anatomy. In these 3 blood vessels, when there is a sudden blockage in any one of the vessel, it is called as heart attack. Okay. When a vessel that is supplying the heart muscle that has a blockage, that has a sudden 100% occlusion, that means that territory is not getting enough amount of blood. So that territory won't able to pump. So that cut of blood is what will cause you chest pain. Okay. So that is when you get an heart attack and you go get treated. So people do an angiogram. Angiogram is nothing but seeing these vessels in an X-ray.
Okay, let me try to understand. Heart attack is basically vessels pumping when there's a block, when blood is not pumped and heart is not functioning properly.
When the vessel is blocked, it is heart attack. Cardiac arrest is something, if this heart attack is massive, okay, it generally happens in massive heart attacks, you get a cardiac arrest. That means your heart itself is not pumping. Okay, or because of this 100% occlusion, there is an electrical abnormality that has happened. Your heart is beating very fast. So your heart beats very fast, it can go for a cardiac arrest. Your heart beats very slow, less than 40 or less than 30, it can go for a cardiac arrest. Either extremes will cause cardiac arrest.
Okay, the distinction is heart attack is vessel not going in, it's not properly pumping. Cardiac arrest is either it's pumping too fast or too
low as a complication of this heart attack.
So death normally happens when you have a cardiac arrest.
Any heart attack related is death is because of cardiac arrest.
Cardiac arrest. Okay. So now you have established that. You said for a 19-year-old, it could be signal problem. It could be n number of problems.
It can be a valvular problem. I said the valve obstruction that can happen. Even a valve obstruction can cause death. So those things needs to be identified. A proper screening needs to be done.